Dr. Courtney Howard is a dancer, a mother, an emergency physician in Yellowknife, and a clinical associate professor in the Cummings School of Medicine at the University of Calgary. She's a nationally and globally recognized expert on the impacts of climate change on health and in the broader field of planetary health. She's also vice chair of the Global Climate and Health Alliance. So thank you both for joining us. Just to help set up our conversation, I was thinking a little bit about some of the points that the presenters in our last webinar raised, including just some of the surprising insights, I think, for myself anyhow, around who are seniors and what is the opportunity. I loved that moment where they shared the suggested actions that people take on Seniors Day, which was giving a card or helping a senior across the road. And instead, the challenge that was put forward was to entirely flip that switch or that narrative. And so what we found out is that, seniors are actually more supportive than other segments of the population on climate action. They're more motivated by a moral responsibility to protect future generations. And they want to write the legacy that they're leaving behind in terms of the planet. They're more politically engaged. They have more resources, both in terms of time and finances, to make a change. And so they're really important. And so the challenge I think that was put forward was to tell a story about this kind of tremendous cohort of people with knowledge and skills and years of experience, who have the time and the energy and the financial resources and the determination to tackle the climate crisis. So I think that this is a moment, both of you think and talk a lot about this, and just to kind of hear from your perspective, why do you think October 1st is, and this particular event is so important, and how could we use this moment to reinforce some of the urgency and the need to move away from fossil fuel and burning fossil fuels? So Courtney, would you like to start us off?
Sure, thank you. And thank you so much for having me. I'm coming to you from Chief Prague's territory, which is the traditional territory of the Yellowknives Dene, the North Slave Métis, and the Welliday Dene. And I love the way you've set this up. Some of you know I spent about 6 months trying to be a politician. And so I can speak from some degree of experience and say that politicians really care what seniors think. We know that you have money to donate, and we know that donations are actually a really big determinant of who ends up winning. When I was running, that was the only thing the media tracked, was how much everybody had fundraised, because there's such a strong correlation between fundraising and who ends up winning. So donations matter, votes matter, who shows up matter. Essentially, politicians respond to the people who show up. And every person who works on planetary health that I know of, both nationally and internationally, believes that politics is the limiting factor in our response. There's all sorts of things we can each do as individuals, but really we require political solutions. So I'm overjoyed to hear that that's really your focus, and I want you to know you have tremendous power. So knowing we're coming out of a difficult summer, I just wanted to present maybe a slightly newer or new framing that you can use to help inform some of your work and some of the energy behind this. So as I've gone about this, I've realized that although I went to school to learn how to resuscitate the complex self-regulating system that we walk around in every day, and I thought we did that in the hospital, what I now understand is that our human health is completely underpinned by the health of the complex self-regulating system that we walk around on every day. And so as you move forward working on climate change, I'd encourage you to incorporate also some other elements of the planetary boundaries framework that also incorporates work around fresh water, biodiversity, ozone as well as nitrogen and phosphorus, because I think it can help people understand that really what we're talking about is the actual stability of the Earth system itself as an organism. And so when I think about this, knowing that 6 out of our 9 planetary boundaries are actually now out of the safe range, as an emergency physician, if I think about the planet I'm walking around on every day, we would be standing in the emerge and the sound we would be hearing would be beep, 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 which means go right now and do something to resuscitate that organism. And so sometimes I've spent a lot of time trying to get the mainstream medical world on board with this. I used to very frequently get the answer, we're not environmentalists. This diagram is what finally helped me get the Canadian Medical Association on board. So this is now in their strategic plan. I was on the board, and every meeting for about 2 years, I described the planetary health nest with my hands, saying our necessary structural underpinning are our ecological foundations. If that is stable, we get to build the social and economic systems that give rise to what we know are the social and structural determinants of health, things like income, housing, etc. When that's stable, we get to build, staff, and supply the incredibly complex structures that are our healthcare systems. And so once I started describing it like that, the surgeons will mostly want to be able to show up in the operating room at 7 o'clock on a Monday morning and have everything work and have the supplies they need, all of a sudden understood that what I was talking about wasn't something that was lateral to what they do, but instead was something that was absolutely necessary for what they do. And it was at that moment that there was essentially an aha moment, and all of a sudden this got onto the strategic plan. So if you're facing that in any of your communities, I would consider starting to maybe use some of this framing. I know after a summer of heat and fire that things can seem overwhelming. So as you move forward, I really encourage you to zoom out, take a look at the overall structure, figure out a thing you can do, whether it's something in your mind, in your family life, in your personal practices, in your community, or more broadly, zoom in on that target, use strategic tactics and heart moving stories such as Reclimate is so good at helping us figure out to win that thing, whatever it is. Maybe you're making beans for breakfast instead of eggs because they also have a lot of fiber and a lot of protein. It takes some organization to do that. That's a win. What the behavioral change evidence shows is that it's those changes, those very concrete moves that actually lend hope, that give us the energy we need to go on. And so whatever it is at whatever level, micro, meso, macro, what I love about this work is figuring out what those winnable things are, doing them, because what happens is you attract resources, you attract political resources, social resources. We all like to get on a bandwagon, and that's what can happen if you do this work. So some of the priority things that actually make life better right now and improve the climate tend to be easier to sell to decision makers. So basically, anytime we decrease fossil fuel related air pollution, which is estimated to cause up to 1 out of every 5 global premature deaths, we save lives immediately. We keep kids out of the emergency department with asthma. We let their parents then go to work because they're not sitting in the emergency department with their kid. We decrease deaths from the top 5 chronic diseases that kill Canadians. So when we move to clean electricity, we save lives. When we move away from fossil fuel transport, we save lives. When we plant trees, we decrease air pollution, save lives, and give people a natural environment that they can go to enjoy the health benefits of nature that we know reduce stress and give people a place to generate a sense of community. So when we move towards plant-rich diets, we know that we save land, we save water footprint, we also can give people a chance to experience the therapeutic effects of gardening and increase local food security. So all of these things are referred to as elements with co-benefits for health. And they've been shown in studies to actually be things that are really appealing to decision makers. So they're areas where it's easier to move the dial and kind of can be winnable campaigns and really good targets. CAPE is running a great campaign about reducing gas-fueled stoves and connecting it to reducing fracking in the north of BC, stuff like that, where you can help people connect something that's really relevant to them in their day-to-day life and a choice that they can make with a broader policy issue with equity consequences that then becomes more salient for decision makers. Those are really, really important targets. And so really, I think it can be helpful for us, instead of this really binary narrative we've had, save the planet or else, to start instead thinking, okay, how can we walk step by step, target by target towards well-being, building a good day for ourselves now and into the future. Some of the things that are evidence-based happiness are on the right-hand side there. It's as simple sometimes as choosing an action-oriented thought instead of a doom scroll inside your head. That's the sort of energy in your bucket to do this work. And so there's a lot of evidence around the health benefits of well-being. And I think that as we more and more start to move towards a society that is broadly oriented at every level towards well-being, the more we're going to be working from a place of power and love and hope in our hearts, and simply putting forward measures that are going to make life better now and into the future. So I'm just starting an organization that's designed to really do that, harvesting some of these energies and ideas we have in our academic institutions that sometimes spend too much time in academic papers that nobody reads. So if anyone's interested, you can scan the QR code and get on our mailing list to help share our mischief. So anyway, incredibly happy to be here and looking forward to the discussion.
Karen, I'm going to invite you on. If we have a couple minutes for a couple questions, this would be the time.
Okay, well, we've got a lot of questions, so I'll try to pick a few that have received lots of support. Catherine Jane Hazel asks, how do we get the same access to government as fossil fuel lobbyists? We get half an hour after trying for months to get an appointment. The oil and gas reps seem to get unfettered access.
After running for the Green Party, realized I wanted to learn a lot more about well-being economics. So I went and did a master's in public policy at the Blavatnik School of Government at Oxford. And I was very lucky to work with Kate Rayworth and Eric Feinhocker and all sorts of people. And so the answer they would give, I think, is the structural power of business. So the fact that politicians partly get judged on whether or not they create jobs, and they see industry as a way of helping them to create jobs. And also we have, so that's one thing. So they see them as a route to jobs, whereas I think most of us are a route to votes. And so there's power in both of those positions, but it's a different kind of power. And so I think recognizing that is important, but also, when I look at what happened after we passed the anti-greenwashing bill, and all of the companies had to scrub their websites, I realized that I think doctors included, a lot of powerful people in Canada have been probably mostly unconsciously working with a mental model that has been provided by the fossil fuel industry. And I'm including a lot of very powerful doctors. When I did a landscape analysis of the Canadian medical school system last year for Health Canada and the Association of Faculties of Medicine of Canada, the number one barrier was that the most powerful doctors didn't know what they didn't know. And when I sort of said to a bunch of them, have you ever read a journal article from the Lancet Planetary Health or the Journal of Climate Change and Health? They didn't even know those were journals. And so I think that if we understand that the fossil fuel generated misinformation is totally pervasive. You look at the editorial board commentaries of the Globe and Mail and other major newspapers, people are not working with an evidence-based perspective. And I think we essentially have to overwhelm them with numbers and persistence. And I know that's really hard. And what I would say is that there is a lot of courage in community and strength in community, and that the more you can make it fun for yourselves, the better. I literally used to bake cookies for every single presentation that I ever gave, so that when people got sad when I was talking about wildfires or, heat emergencies, and they all looked like they kind of wanted to jump off a cliff, I was like, double fudge. So keeping the energy up, keeping the energy in your own buckets as a community helps you attract other humans, because humans like good energy. So then you have more people. And then you can start to be like, okay, we're just going to keep going and talking to Peter, hey, Peter, and you show up enough times, you start to build a relationship. They start to know you. They know that their interaction with you isn't going to be definitely painful for them. If it's always painful, they're just going to turn around. And so building those relationships, you start to have influence over them. And when I think about what seniors bring to the table, you bring so much in the way of smart and savvy in those types of interactions because you've done this before. And many seniors are looking for a way to spend time that has purpose. And so I think that if you get a group together and just keep being there pleasantly, persistently, I actually think that that is an incredible way to start to overwhelm that structural power of industry because really at the end of the day, the politicians need the votes.
I have one more for Courtney. James Cleland asked and says, Courtney, I liked the way you connect healthcare to the web of life. How could we do this for other activities like agriculture, forestry, finance, etc.?
I think what I love is when you think about the planetary health nest and you realize that most studies show that probably only somewhere between 5 and 25% of overall health outcome is related to healthcare. That means that when we make other interventions, we all have the ability to become planetary healers. I know that when I'm staying up at 3 o'clock in the morning to look at a patient's blood work, I'm not doing that because like almost nothing that I do is because I get paid to do it. It's great that I get paid. That's awesome. But I do most of my work for free in planetary health. It's because I care. And I care about the fact that I want people to be well. And when you look at surveys, you look at the thought of thinkers back to Aristotle, you look at Bentham, this has been something that people have wanted forever. And so I really think that if we set well-being as the ultimate goal of our society, that is the thing that we all want at the bedside at 3 a.m. when people are scared. They want to be well. That is what every single person I have ever met in any clinical interaction across Canada, across socioeconomic strata, across the world wants. They want to be well and they want the people they love to be well now into the future. So if we connect that desire and value we all have on the personal level with our policy, with our actions at the personal level, what we do as a family, the policy measures we put forward as a community, all the way up subnational, national level, and it's all aligned and we know that that's our goal. So living well, a good life for all within planetary boundaries now and into the future, I think we'll be pulling from this place of purpose that has, in a GDP and income-based economy, really been untapped. And I think that it will help us act with love. And man, that is an unexhaustible resource. And so thinking about where we're acting from, how we're aligning what we do personally with what we're aiming for nationally, I think that those are all ways that we can start to feel that our actions are healing not only ourselves and our planet. And it's amazing what kind of energy that gives you.
You both, spoke passionately and laid out, some complex ideas. Courtney, you highlighted some of the points that we know resonate with seniors. We know from the work that we've done that they're very interested in health. And David, we know that from some of the work that we've done that the majority of seniors are very interested in the legacy that they're leaving behind and feel a sense of responsibility to their grandchildren and to their children. So knowing that we've got 465 people on this call, what would be one or two things that that we could be asking from your perspective? What are one or two things that seniors can do after October 1st to keep the momentum going? So I'll leave that. I'll go to you first, Courtney, and then to you, David, and then we'll move over to some Q&As.
I would love it to be very clear for anybody who's going to be a candidate in the next election that they simply can't get elected unless they are willing to have a healthy response to climate change. Because, yes, you may be part of, a party that doesn't believe in that, but at the end of the day, you have to get elected by the people who live in your neighborhood or in your community. And personal relationships matter a lot. That's why lobbyists exist. I often get asked, do I travel for the planet? And what I've learned is that I lose votes if I don't travel. And so if it's important, yes, I travel. I get on the plane and I go see whoever it is who's powerful and is in charge of making that decision, because we all evolved to trust one another with the physiology we're walking around in right now. You know, we trust the people that we've seen, that we've been in proximity with, that we've danced with, that we've shared meals with. You want your potential politicians to think of you that way. There's a reason pharmaceutical reps go to doctors' offices, try to bring them lunch. They know the names of your kids. They actually keep notes on this. And so right now, when we tracked it, we worked with a scholar with the lobbying ratios. And what has usually been found is that most federal politicians see about 5 fossil fuel lobbyists for every 1 NGO lobbyist. So when we think about just how much we trust the people we see, I think that's a big reason why we get the outcomes we have. And the way funding for NGOs goes, you know, part of what I'm hoping to do with Power is have evidence-based lobbyists, but it's going to take us time to get to that in terms of money. And so you can do that. And I think there's no reason to be nasty about it. What I would tend to do is bake like your best cookie recipe and like take it down to the constituency office or the electoral office and like have a nice conversation with someone, get to know their staffers, be like, hey, climate's really important. Bring your baby grandkid, bring your puppy. Apparently, this is also really helpful. Humanize yourself. I think many of us struggle with climate anxiety at different parts of our journey. And that often shows up as us acting out of anxiety. And I think there's a difference between the fact that action alleviates anxiety and acting out of anxiety. Because when you're that anxious person, you give off a certain energy. And I've been that person so many times. People will like, when I used to start to show up at medical meetings, because David, I have given this whole thing a good go. And to reassure you that the deans of the medical schools are going to vote on a plan that I wrote on October 28th that will hopefully like centralize this in medical schools, but it has taken 15 years. And part of the reason was I used to show up and they didn't want to talk to me. They would like duck. I would see people ducking into the bathroom when they saw me coming. So you don't want to be that person. Got to think like a lobbyist. Show up looking nice, bring them food, be pleasant to talk to, but yet very persistent about what you want. And if we can do that around the country for every single political party, be like, look, you are not going to get elected unless you have a responsible response to the climate. They will start to feed that up through their party. And I think that is something that really seniors would be extremely well placed to do because we know they already fear you.
Thank you, Courtney.